Hey everyone, Coach Investor here back with another video for you today. So in today's video, we're going to talk about Clover Health. A lot of you have been asking me to cover this company. So here it is. So Clover Health, if you don't know, is actually the third company that Chamath and Social Capital, his venture fund, is actually bringing to the market, is merging with. First one was Virgin Galactic, then Open Door, which we've talked about recently, and now we have Clover Health. So we're going to talk about what they're doing, why he thinks that this could be a 10x in the next 10 years, why this market is growing like crazy, and then obviously some of the risks as well. But before I get into this video, if you haven't subscribed yet to this channel, help me reach 6,000 subscribers by hitting that subscribe button. And if you like these videos, leave it an early thumbs up as it really helps me outgrow the channel and get my videos out there. So without further ado, let's dive into this. Alright, so IPOC is the ticker symbol, obviously IPOB is Open Door, and the first one was Virgin Galactic. So we can see here that when they announced that they're going to merge with the company and put it on the public market, the stock went on a 30% rally. And then October 6th, it was announced that that company is Clover Health. Obviously the market was not very happy with that, dumped all the way back down to around $10, and now we're just at that $9.98 or so. So obviously, if you like speculations, if you like in the short term, could be a 30% play if it goes back up. Right now also the RSI is pretty low. So yes, we're forming a little base right around those $9 to $10 or so. So yes, if you're convinced after this video, might be a good time to pick this stock up. Right, so let's start from the beginning. In 2013, Clover Health was founded as a medical startup. They started by selling obviously healthcare plans to their customers. Now they also have this thing called Clover Assistant, which is their software, which is sold to physicians and doctors, which will help them give patients better healthcare at better costs as well. Actually, people that are members of the Clover plan see 22% fewer hospital visits. Now the overall Clover cycle looks a bit like this. So they get into a market, they acquire members and doctors, they get their data, they learn it, it saves cost obviously, then they reinvest the savings to improve the plan, which would lead to less cost, consolidates the market, and then we go back to the first step, which is getting new members, doctors, etc., doing that over and over again until obviously they get more and more market share and people get better healthcare and obviously at a cheaper cost. Now to get a better picture on how big the medical care industry is, let's talk a bit about numbers. Basically, Medicare is projected to be a $1.25 trillion market by 2025. Now, private insurance, which is in this case the Medicare Advantage, so people that are 65 or up, right now is at $270 billion. And by 2025, it is expected to be at around about $590 billion. How is that possible, you may ask? Well, every day, 10,000 people turn 65, which means that this market grows by $1 billion every single week. Crazy numbers. Right, so you might ask yourself, Medical Advantage, what is this? Maybe you're unfamiliar with that. Who pays for it? Where does the money go, etc. So basically, when you're 65 and older, you're eligible for this plan. So how does this work right now? So basically, the government reimburses physicians and healthcare companies who provide services to those that are 65 and up. So right now, instead of government paying back those physicians or those healthcare company, the money will be going to those private healthcare insurance companies, which we all know that private companies always look to innovate and innovate much faster than government bodies. And in this case with Clover Health and their use of machine learning, data, etc., a bit like Lemonade if you ask me, but we're going to talk about that in a bit. Now you might ask yourself, how big is this 65 years old market and up? Well, basically, it's pretty big and it's going to get bigger and bigger each and every year. So the population of people that are 65 and more is actually going to double in the next 40 years. It's also growing 5 times faster than other categories. And this in turn means that Clover is actually growing 2 to 3 times faster than its next 9 competitors. What this means is that they'll take 50% of every new available members versus obviously the other companies. Now, to go back to my point of useless cost and reduction of cost, that's why they're going to private companies. Well, last year, healthcare spending was $3.5 trillion. 30% of health expenditures in 2019 was wasteful, which means that $1.1 trillion has gone to waste because of, well, administrative costs, doctors, physicians, those companies that aren't really doing their job properly. Lots of costs that with Clover Assistant or any other technological advanced company or software is not going to happen. Now, right now, Clover Health is actually pretty small in the United States. They're in 34 counties and have 54,000 members. In 2021, they expect to be in 108 counties and have 73,000 members. Now, their revenue last year was $462 million. They expect that revenue to be $1.72 billion by 2023, which would mean that it will grow at a 41% growth rate. They also expect to be profitable in 2023. So obviously you will have to wait 3 years from now for them to be profitable. That's why there's a big premium on that company and on that stock right now. Now, regarding their margins and their medical loss ratio, actually Chamath says they are already better and will be better moving forward because of the use of tech. Now, this goes back to my point about comparison to Lemonade. Lemonade, the same thing, going into that super old industry, which is the insurance industry. Healthcare is also a super old industry that is ripe to disruption. Both companies try to reduce, obviously, Lemonade, their gross loss ratio. Here, Clover, their medical loss ratio. I think both companies with the use of data, AI, machine learning are obviously going to go much faster than these other companies that are not using technology to advance and to reduce costs. Now, obviously, in order to grow, Clover actually recently partnered up with Walmart to provide Medical Advantage plans to all of its customers. So that's actually one of the ways how they acquire such huge chunk of customers is they take one company, one body, let's say one hospital or whatever, and they acquire all that customer base, or they try to acquire that customer base. And that's how they expect to grow much faster than usually what other companies are growing. All right, so now let's talk about the risks, because obviously there are some risks in this field as well. Obviously, first of all, there's big competition in the healthcare industry. Obviously, you have Humana, United Health, Blue Cross Blue Shield, I believe, and many, many more. Obviously, healthcare in the United States is something that is pretty broken, and those that are at the top have a lot of money to defend themselves. But again, if they don't innovate, if people will see that, oh, we can do stuff cheaper and faster, they will switch pretty fast. Then another problem that is a problem right now, obviously moving forward, I would assume this problem will disappear, because right now their membership is very concentrated. 97% of their members are concentrated in New Jersey. Obviously, with them growing the United States, I would assume that number will be reduced by a lot. So this is something to keep an eye out. And then obviously government regulations, because right now all of their revenue actually comes from that program that the government is sponsoring. So that Medical Advantage plan, if the government suddenly says, we're stopping, huge problem. And lastly, maybe the CEO might be a problem, because he founded lots of other companies before he founded Clover Health. And recently there was an article that came out that said that they were investigating some suspicious stuff that was happening before. And they're also investigating Clover right now because he is the CEO of that company. But in my opinion, if someone like Chamath, Social Capital, and GV, which is actually the investment arm for Google, are invested in this company, I'm pretty sure they did their due diligence. So for me, that's not a problem. And if it would be a problem, I don't think it will take long to replace that CEO. All right, so to conclude, I'm not invested in this company. I'm not looking to open a position in this company right now, because for me, this whole medical healthcare thing is pretty unknown. So I'm not going to jump into that. It is very fascinating what they're trying to do. Obviously, they're trying to do something that is going to help millions and millions of people moving forward, because healthcare should be affordable for everyone. If you can save $1.1 trillion each year because of this software, I think you should do it. And again, why shouldn't you use such a software? You save time, you save money, you probably will save lives as well, so why not? But right now I will be looking on the sidelines again. Very good idea, pretty good company, but right now I'm staying on the sidelines. And that will be it for this video. If you liked it, consider leaving a thumbs up. And if you haven't subscribed to this channel, hit that subscribe button. And as always guys, take care, stay safe, and see you all in the next video. Bye bye.